Hello everyone, this is Dr. J from LifeSpine Health Enhancement Center. This week's video is an important one that talks about low back pain. And one cause of low back pain can be attributed to what's called a spondylolisthesis. Now, that's a big long word, but it simply describes two bones of the spine that have become grossly misaligned that's putting pressure on the nervous system, the discs, or perhaps the muscular tissue that supports the spine. Now, to illustrate what a spondylolisthesis looks like, I have two model bones here. Now, viewed from the side, as we are looking at it now, the bones stack up on each other in a smooth transition. What a spondylolisthesis is where the bones become misaligned to a point to where the front and the back part of the bones do not line up in a smooth manner. When this happens, it puts a lot of stress upon the muscles that attach to those bones, causing muscle spasms, tightness, and pain, but it can also put a lot of shear force upon the cartilage disc that's in between every bone of our back. If the pressure is not removed and if the spondylolisthesis is not corrected, then the disc will eventually tear, bulge, and herniate, and over time will degenerate. The other thing that a spondylolisthesis causes to the spine is that it changes the size of the hole in the back part of the spine. Normally that hole is very large and very open, and it allows for free communication of the delicate nerve root that branches from the spinal cord and exits from the spine to supply function to all the muscles and organs of our body. But when the spondylolisthesis sets in, it actually narrows and it changes the size of the shape of that hole, which can put pressure on that nerve root, creating a pinched nerve or an irritated nervous system, and that's what also contributes to the symptoms of pain, aches, stiffness, burning, maybe even some numbness and tingling that can travel either down your backside into your legs and feet, or if the spondylolisthesis and nerve irritation is up higher in the spine, then it will cause neck pain, shoulder pain, and symptoms that can travel down all the way into the hands. Now, there are many, many reasons for a spondylolisthesis to occur, and many different types of a spondylolisthesis. And it's important to identify which type of spondylolisthesis you may have. That's going to allow a conversation to find out which course of treatment is going to appropriately and safely treat that condition, and not just give you a pain relief, but potentially prevent any further complications from developing down the road. So I encourage you to follow the links, go to our blog article this week that talks about the different types of spondylolistheses and also ways that you can conservatively treat them. But the most important thing is to be properly evaluated by a chiropractor to see if it can be conservatively cared for rather than allowing it to progress to where surgery would be the only thing that can care for it. I hope you enjoyed this video. Please, if you want to see more videos like these, click on the subscribe button below. We have updated information on a regular basis. But in the meantime, visit that webpage, share it with others, and learn more about what could potentially be causing your low back pain. Once again, this is Dr. J from LifeSpine Health Enhancement Center.